Let's continue along with the theme of hospital protocol. Again, I want to make you feel comfortable in this setting. I know we feel comfortable in our churches. We feel comfortable preaching, and we feel comfortable teaching the classes. You're coming into a different arena now. I want you to know some things of what goes on in the hospital so that when you as a local minister just go, oh, that aha moment, okay? Not again like our brother asked about becoming a professional teaching it, just feeling comfortable in this setting. One of the things is understanding HIPAA. I'll explain that to you. Understand standard precautions like washing hands, how hospitals get paid, and how is the chaplain's program good for all. Let's explain HIPAA a little more. That terrible word that gets in the way of you getting information, and basically pastors hate it because you used to get more information and you used to be able to ask a nurse something or come to the front desk and get a whole census, and now they won't do that anymore. Basically, it's all because the government wants to protect us. It wants to protect our name, our address, our phone number, our medical record number, our date of birth, our diagnosis prognosis, our social security number, our patient account number. They want to protect us as a patient here. Too much information was getting out. Let me say this to the minister. I was a minister for 16 years. When I would go in the hospital to get information, I'd walk back to the church office, and what does the secretary do? Tell me, is she going to surgery today? What happened? What's the condition? What's going on? And she would get on the prayer chain, and she would write on a whiteboard there that Joan is in surgery, and this is the hospital she's in. I mean, that's just what we did, okay? I got drilled, I gave information, okay? And then, without really asking, they went on the Wednesday night prayer list. They went on the prayer chain. They went, you know. Now, HIPAA is not getting after you. But I'm just saying, as a local minister, beware. What if we were to ask Jane Doe, would you like to be on our whiteboard there at the church? Would you like to be on the prayer chain? Would you like us to include you Wednesday night in the prayer list? Sure, 99% would say. The 1% would go, I dare you. Well, that's the 1% we didn't ask. And we put them on the list that, you know, Molly's having a double mastectomy tomorrow. And she goes, what? Or the man's having prostate surgery. We go, I dare you. But we thought, well, everybody wants prayer, don't they? 99%. So then, now, I guess that's going to keep most of us from putting on a prayer list. What I say to ministers, do you think God knows the details? Do you think maybe He can help Molly? I know she's in surgery tomorrow. We're not, you know, we don't have to spill all the goods. Now, HIPAA's not going to come after you, but they are going to come after hospitals. And so since we're protecting our patient, your parishioner, your member, we're not going to give information we used to, okay? I don't look good in stripes, as you can tell, and I don't want to be in prison because I gave a fellow minister too much information. I like my job. I would lose my job immediately. I would go to prison, and I would pay up to $250,000 fines. I don't want to go there. And so you're going, why is the hospital so serious about this? Because it happens all the time. Where loose-lipped people give out information, and we're not going to go there anymore. So you get frustrated at us. So I'm saying to you, tell your people, if you go in the hospital, ringy-dingy, call me. Do they? No. So that's not my fault, not your fault. But I've had people leave my church because I didn't visit them. I go, well, did you call me? No, but the phlebotomist who took my blood, she goes to your church, and she should, you know, I didn't get called. So tell your people, you don't have ESP, you can't read minds, call the church. I'll be glad to visit you. Call me and tell me your condition. So you get information from the patient. The patient can tell you their condition, their prognosis, their diagnosis, what's going on. They can tell you all day long, but you're not going to get it from hospital staff. Part of this is also the kind of need-to-know basis. You as a volunteer chaplain, if you need to know information, we will let you know. And you will know information that the nurse doesn't know. Like you know if family's coming into town, or if the patient's in pain, or if the patient says, I'm afraid, or if the patient says, my stomach hurts. You know, it's just things you can go to the nurse, or ask the patient, did you let the nurse know? Well, no, not really. Well, you want me to let them know? No, then you don't. Again, you're protecting patient right. Patient may say, I'm really mad at this hospital. Would you like me to help you report it? No. Okay. Would you like to report it? Yes. Sure, I'd be glad to do it. It's like, if they want you to, you respect that. There's a patient code word. When a patient comes in the hospital, they may say to the nurse, to the patient, what's your code word? Make up a code word. Maybe your cat's name. Make up anything. And then when they make up that code word, you use that system? Patient code? Okay. When they give you that, then as a patient, you go, now you tell whoever you want to that code word. If you don't want somebody calling in and getting information, don't tell them. But whoever you tell, if you tell a pastor, and a pastor calls in, hi, I'm the local minister, I have the code words, the cat's name is Bobby, okay, give information. So you tell as a patient whom you want to get it, because when they're calling in and they say, I'm the sister, or I'm the wife, or I'm the daughter, we don't ask for birth certificates. We don't ask for marriage license. We don't know. But if they've got the code word, then they let the information. So you go, as a local minister, maybe they're alone, maybe they're all by themselves, and you are their only buddy, their only friend. Give me the code word, and I can check up on you. But a lot of times you can call the patient's bedroom and say, how are you? You don't necessarily need to talk to the nurse. Talk to the patient. Talk to the family members. Get information from them. A volunteer, you need to wear your badge at all times. You may be on call. I would keep my badge and extra clothes with me at all times. There are times when I'm out kayaking and I get my page and I get there as soon as I can and I don't have to drive home first. I've got all my stuff, my badge and my clothing right with me, so because I'm on call that day and I can be ready. There may be times when you're coming in and you're doing a visit and you're going, oh, I could visit a few patients. If you have your badge that we're going to give you, you can. But without that badge, you're just local clergy. Okay? You need that because that's the hat you're wearing at that time. And if you probably won't have passwords on a computer, but if you did, you would protect passwords. Be careful about what you say and where you say it. Let's say you're in the cafeteria, you're on the elevator, you're in the hallway, and you're chatting about a patient. Be very careful who's walking by. Be careful what you're saying. And this goes on all the time. Doctors, nurses, employees shouldn't do it, but they do it. And we need to be careful about that. Especially if you have a booming voice. We have one physician, you can hear him 2 blocks away. And he just, like, come on. You know, he's just loud. Well, you try to keep that as quiet as you can so that no one else hears about the diagnosis or the patient's name or what's going on with the procedure, so you keep that quiet. If you as a volunteer chaplain, we're giving you a census. When you get done, we will show you where to put that census to be shredded. Do not take it home. You may say, well, I'd like to jot down a few for a prayer list. Good memory. Do not write patient names down and take them home. That's protected information. No matter if you write it, record it, whatever, that should stay here. And you go, but I want to, again, does God know those names? Can you start praying tomorrow? I can't remember their name, but you do. Okay? Just protect that. Keep that private. And don't take it home. And then there's fines for violating those kind of things. Standard precautions like washing our hands is huge in the hospital. I know it sounds like your mother telling you to wash your hands like you have OCD, obsessive compulsive disorder, but I'm obsessive now, okay? I don't care if people laugh at me. I'm going to be obsessive. And you know what? I've been a lot healthier. I haven't had the common cold since I've been washing more, okay? I think I may have prevented a lot of things just because I was just stupid before, thinking, God will help me. God's going, you're on your own, buddy. You know, just use your head. I gave you your head, you know. So it's like wash our hands for 15 seconds. Some say sing happy birthday to yourself or whatever, you know. Take your time.